Start our session. So fast code 21's pre-medical coding YouTube live CPC certification prep session 35 on July 30th 9:15 p.m. IST. So topic cardiovascular system CPT coding. So all of you go and try to answer this question. So in order to help your guys, I will post the procedure name here. So that is the procedure you need to choose. Yeah. So now it is 9:17. We will discuss the answer at 9:25. So I will wait for three answers. If I get the three answers, I will start discussion. So you need to familiar with your CPT book so that you can code easily. So just to first try to understand the anatomy, then you can code easily. Thank you guys. So I got three answers here. So we will discuss the answer for others. Okay. So basically what is 33208? So here our procedure is dual chamber transvenous implantable pacing cardioverter defibrillator system implantation with leads. So dual chamber means here physician is inserting like defibrillator leads in the two chambers of the heart like atrium and ventricle. So that's why here dual chamber they have mentioned, and you need to understand that we have same set of like little bit difference among pacemaker and cardiovascular defibrillator system coding. So you need to cautious while coding pacemaker or AICD. So you need to take care while coding these ones. So here first of all we need to check the keywords. A 61-year-old male, okay, that is fine. So after informed consent ban had been obtained, the patient of outpatient hospital in a fasting state. See here, this is the keyword here. Anterior chest was prepped and draped in a sterile fashion. Intravenous sedation and local anesthetic were given. After local anesthetic, incision was made at the left deltopectoral region. So deltopectoral means basically it is on the shoulder region, near to shoulder, between the chest and the shoulder. So with blind dissection and cautery, this was carried down to through the pectoralis fascia. The cephalic mean was identified and ligated distally. Through the venotomy, a subclavian venogram was performed to provide a roadmap. So the atrial and ventricular leads were then advanced. See, this is the keyword here, atrial and ventricular leads. That's why here physician has mentioned dual chamber. So as here, physician has placed two leads in the atrium and ventricle. Advanced the vessel to the level of the right atrium under fluoroscopic guidance. So you need to understand that all these procedures include fluoroscopic guidance. So we no need to code separately. So here physician has used the fluoroscopic guidance. We no need to code separately. So the ventricular lever maneuver to the right ventricular outflow tract and then through the RV apex. Okay. The atrial lead was maneuvered to the anterolateral right atrial wall where it was actively fixed. Good sensing and pacing threshold demonstrated. So as anyway, see here we have one more keyword here. A subcutaneous pocket was created with good hemostasis noted. The pocket was subsequently irrigated with solution of bacitracin. The generator was so. After this, we no need to worry about anything. Why means in order to place ICD, patient has used two leads here, and here patient has performed generator insertion. So if you check 33208, this is for pacemaker. So but here physician is placing the ICD, not pacemaker. So we will eliminate 33208. So as we have discussed just now, fluoroscopy guidance is included in the this pacemaker and ICD code. So B is also wrong. So here if we check 33241, what is 33241? Removal of implantable defibrillator pulse generator only. So basically C is also wrong. Why means this is the initial insertion for the patient, not like removal of the ICD. So our option is we are left with D, 33249. So what is 33249? 33249 is for insertion or replacement of permanent implantable defibrillator system with transvenous leads, singular dual chamber. So our answer is D, 33249. So whenever you code, just you need to check the keywords, and as soon as you get the keywords, you don't need to read every operative procedure, just you directly you can code. I hope most of the people wrote correct answer only. Thank you guys. So we'll go ahead and check second question of the day. Yeah, you can check now. So now the time is 9:24. We will discuss the, as you know, if I get three answers, I will start discussion. Yeah, thank you, Sarika. Thank you very much. So we need to wait for two more answer. Then we can start. Yeah, lucky we have started new SDS batch. So one is on the weekends, 7 to 9 a.m. and one is on the weekdays, 8:30 to 9:30 p.m. So if anyone is interested to join, you can join. So wherever it is possible, we will try to finish the session smoothly, as these are the small questions we can do easily. Thank you, Bobia. So we need to wait for one more answer as soon as we can get. Yeah. Thank you, Nagatarun. Thank you very much. So we have three answers now. We can discuss the answer. So the patient comes in today for have an arteriovenous fistula created to facilitate dialysis. The surgeon performs an upper arm basilic vein transposition based on the patient's previous arterial duplex scan, which is the appropriate CPT code for this procedure. So basically, based on our keywords, this is a basilic vein transposition. So if you check this 360, 36,800 series, 825 is for creation of arteriovenous fistula. So it is not performed here, and we will check non-autogenous graft. That is also not correct. So we will check 36818, which is arteriovenous anastomosis opened by upper arm cephalic vein transposition. D is for basilic vein transposition. So based on our keywords, patient has performed basilic vein transposition. So we need to select 36819. So our answer is D here. Yeah, thank you, Satish. So D is the correct answer. Thank you, guys. So we will go ahead and start third question of the day. Yeah, go ahead and now it is 9:28. We will discuss the answer at 9:35. Yeah, thank you, Satish. Your answer is correct. So if you are going to write CPC exam, you need to be in a position to flip your code books very easily so that you can save your time. Try to use your CPD book while practicing questions as much as possible. So it makes you comfortable while writing the CPC exam. Yeah, no worries, Anita. We can do it. I can do it for you. Is it okay now? So third question, answer please. Yeah, thank you, Satish. Yeah, thank you, Raju, Sarika. So we got three answers. We will discuss our answer. So basically, it is the So a 57-year-old with lung cancer developed an effusion. So you guys need to remember that effusion is accumulation of the fluid. Okay. So that is suspicious for malignancy. So needle aspiration is performed to obtain sample of fluid or pathologic examination. So what happens if the physician removes fluid, he will send fluid sample to the cytology department, not surgical pathology. So you need to understand that we have cytology and surgical pathology, both are different. If the physician removes fluid, he will send to cytology. Here physician sent it for cytology. A needle is withdrawn between the ribs and into the pleural space, and fluid is withdrawn. So the specimen is sent to pathology. So here there is no documentation of biopsy of the pleura. So we will eliminate 3 to 3 to 400. So here there is no tube being connected to water seal for continuous removal of fluid. So we will eliminate 3 to 551. So we are left with 3 to 554 and 3 to 555. So based on our documentation, there is no imaging guidance included. So we will select 3 to 554 as the correct answer. So which is A. So here our answer is A is the correct answer. Thank you guys. Thank you very much. So you need to check the keywords while like coding or while writing the CPC exam. So these are the small keywords, but if you miss those, so you may lose your 1 mark. So see here we have one course looks like same only, but without imaging guidance with imaging guidance. So you need to have cautious while coding like these procedures. So we'll go ahead and start with fourth question of the day. Yeah, go ahead, and now it is 9:33. So we will discuss this answer at 9:38. So as all of you know, if I get three answer, we can start discussing the question. So if anyone wants to join in surgery training, please let us know. We are started surgery training also. Yeah, thank you, Sarika. So we will wait for two more answers. Thank you, Tarun. So while writing the CPC exam, you need to concentrate more on the small question and answers. So there you need to find the answer within a short period so that you can use remaining time for complex procedures. So just open all the codes and check the description. That's fine. That is enough. You don't need to waste, or it is not good to waste your time. Okay, Ovia, thanks for your answer. Yeah, thank you, Anita. So we will discuss our answer. We got to three answers now. So this 25-year-old male presents with deviated nasal septum. So you need to understand that whenever you code any type of procedure, you need to consider the medical necessity of the procedure performed. So here patient has deviated nasal septum. Surgery over here. So we have started currently surgery trainings. So this is the keyword here, deviated nasal septum. After intubation, a left hemitransfixion incision was made with elevation of mucoperichondrium. Cartilage from the bony septum was detached and the nasoseptum was realigned and removed it in a piecemeal fashion from the obstructed perpendicular plate of the ethmoid. So here it is the uh, keyword, bony septum was detached. This is the keyword. Therefore, fluorochromic was used to approximate mucous membranes. A small amount was, this is normal only. So here you need to check all the answers. So you need to understand we have rhino in these four options. We have rhinoplasty and septoplasty. But based on the documentation, physician has performed procedure for nasal septum. So here our answer is A, which is 30520. So which is for septoplasty. Remaining procedures for rhinoplasty. So as rhinoplasty is a cosmetic procedures, we can't code rhinoplasty procedure for deviated nasal septum. So here our answer is 30520, which is septoplasty or repairing of the septum. So okay, is it okay, guys? Can we start fifth question? Just you need to identify rhinoplasty versus septoplasty, and you need to check the documentation whether physician has performed rhinoplasty, or otherwise we can think physician has performed procedure on the nose or on the septum. So if the physician has performed procedure on the septum, you need to code septoplasty, not rhinoplasty. Okay, guys, we'll go ahead with and start question number 5 now. Yeah, now it is 9:38. So we will discuss the answer at rhino means nose. Septoplasty here physician performs procedure related to the septum. So that's why we have different codes for rhinoplasty and septoplasty. Yeah, that is correct. Nose also correct only. Nasal, nose, rhino, all are synonyms. So no worries. So now it is 9:39. Just we can discuss answer as soon as we receive three answers. So those all are synonyms, Nagatarun. So you are correct. But whenever you code, na, you need to check the description of the operative report. So whether physician is performing nose related procedure or septum related procedure. That is the key while selecting the code. So Anita, you need to cautious. What is 30620? 30620 is septal or other intranasal dermatoplasty. So you need to understand that dermatoplasty means skin repair. So physician did not perform any skin repair. So we need to code septoplasty here. So 30520. So now you no need to worry. Just after the session, you can watch the video again tomorrow. So just go ahead with this one. Fifth question. Yeah, thank you guys. So we got to three answer. We will discuss our question. So here, without wasting like these questions, you need to answer properly. So a 67-year-old male CAD, AP, claudication and several chronic conditions that have been marginally controlled with medication. Okay. The doctor decided that the benefits outweigh the risk for her having a single vessel cardiopulmonary bypass. Thank you, Rajiv. Thank you, Satish. Using an arterial graft. So her medication heparin has been stopped for several days. So she was admitted in the hospital a day before the surgery. Okay. So in the operating room, general anesthesia was administered. So here our keyword is hospital. Okay. Try to remember. In the operating room, general anesthesia was administered. After the chest is opened, the patient begins to hemorrhage and drops in blood pressure. The decision was made to stop the procedure and close the chest. How is the services coded? So basically here we need to understand we need to have good knowledge about the modifiers. So by seeing modifiers only we can find this answer. So basically 52 modifier is for the reduction in the procedure. So here there is no reduction in the procedure, but due to patient's condition, physician has stopped the procedure. So we can eliminate B as the answer. Why means 52 modifier is for reduction in the procedure. But here there is no reduction. Completely physician has stopped the procedure. And 74 modifier is for like ambulatory surgery coding. So basically here procedure performed in the hospital. So hospital is not a ambulatory surgery center. So we will eliminate 33 C option C. So we are left with D 3353353, which is the correct answer. So D is the correct answer as this procedure is performed in the hospital. So 53 means so after the anesthesia procedure has been discontinued. Okay guys. So you need to understand the modifiers properly so that you can save your time while writing the original CPC exam. Anyway, most of the coders wrote correct only. You no need to worry. But while writing the exam, you need to cautious. So modifiers plays very important role while coding or while you are writing the CPC exam. When live coding, surgery coding also modifiers plays very important role. So you need to have good understanding of all modifiers. So go ahead and start with question number 6. So now it is 9:44. So as all of you know, if we get three answers, we can start discussion. Yeah. So if you are happy with this session, please click on like button in order to reach this video more number of coders. If you forget to click on like button, please click on it now. So if you click, it will reach more coders and they will benefit from this session. Thank you, Rajiv. Thank you, guys. Thanks for your like. So it motivates me to provide continuous free education to all. So my intention is to provide free education as well as the paid education with less fee. So wherever you go, just to you need to find the keywords. So if you know the keywords, you can code properly. Thank you, Anita. Yeah, we got three answers now. We can go ahead and start our discussion. So question number six. Mr. Y presents to outpatient surgery for placement of dual chamber pacemaker. Okay. So this is the keyword here. After multiple attempts to manage his bradycardia medically. So basically, physician has tried to treat his bradycardia with conservative treatment. Yeah, sure, Bobia. So I will let you know. Yeah, sure. I will do that. So I think it is better you should join in our WhatsApp group so that you will get latest updates. As you are from US, you can't get most of the updates from YouTube. Just to, you can join our Telegram group or WhatsApp group. So if you want latest updates, so here physician has inserted dual chamber pacemaker. Atrial and ventricle leads were placed under fluoroscopic guidance via the subclavian vein. So testing confirmed appropriate. So these are the keywords here. Atrial and ventricle leads were placed under fluoroscopic guidance. So these are the keywords here. Testing confirmed appropriate placement and conduction. No, Anita, actually I have tried to add you, but I don't know what is going on with you, so I can't add you. That is the problem. Even I have tried to join you also. Once again, I will try after this session. So the left chest was then inflated with epinephrine pocket of. Okay, guys. So here our keywords are dual chamber pacemaker, atrial and ventricular leads, and placement of pulse generator. So based on these keywords, we can understand that it is a initial procedure. So here our answer is 33208A. Our answer is A 33208. So Y means 33213, 33235, 33214 are for removal or upgradation, all those things. But based on our operative report, it is a initial insertion of pacemaker. So you need to, like previously we have ICD and here we have pacemaker. So while coding this pacemaker and ICD, you need to cautious these procedures. Why means both are looks like same only. So okay, we will go ahead and start with. So Satish, so you can do one thing. Send your mobile number to Vincent Medical Coder at the rate of gmail.com. So I will add in our WhatsApp group. Send your mobile number to this one. So go ahead, guys. Now it is 9:51. We will discuss the answer at 9:55 or three answers. So pacemaker and defibrillator little bit confusion. So you need to cautious while coding pacemakers and defibrillators. So Sunny, already we have started our trainings, paid trainings. If you join our paid trainings, you can learn surgery coding. So if you are experienced coders, you can join in our training so you can learn easily. So most of the students we have experienced as well as the SCC2 surgery coding or ENM2 surgery coding students. So if you want to learn live or real-time surgery chats, you need to join in our paid trainings. So we got one answer. So we need to wait for two more answers. So anyway, time is over. So we can start our discussion now. So a 42-year-old female with three vessel disease and supraventricular tachycardia which has been refractory to other management. So okay, she previously had pacemaker placement and stenting of the coronary artery stenosis. Thank you, Anita. So which has failed to solve the problem. She will undergo CABG with autologous saphenous vein and a modified Mays procedure to treat the tachycardia. So this is the procedure. The risk and benefits have been discussed and the patient wishes to produce. She is brought to the cardiac OR and placed supine in the OR table. So you need to understand the position of the patient in order to code properly. She is prepped and draped and adequate endotracheal anesthesia is assured. A median sternotomy incision is made and cardiopulmonary bypass is initiated. So here it is the keyword. Cardiopulmonary bypass is the keyword. The endoscopy is used to harvest an adequate length of saphenous vein from her left leg. This is uneventful and bleeding is easily controlled. The vein graft is prepared and cut to the appropriate length for anastomosis. Three bypasses are performed, one to the LAD, one to the circumflex and another distally onto the circumflex. A modified Mays procedure was then performed and the patient was weaned from bypass. So here what are our keywords? One is median sternotomy incision, next one is cardiopulmonary bypass, next one is modified Mays procedure. So basically based on our operative report, physician has performed bypass on three vessels. So directly we can eliminate B. Why means there is no code related to bypass procedure in B. So and we need to check A 33254. So what is 33254? So one second. So 33254 is operative tissue ablation and reconstruction of atria limited. Okay. So here modified MAGE is performed, but based on CPT guidelines, we can't report 33254 when performed at the same time as another sternotomy or cardiopulmonary bypass. So based on the guidelines, we can't code 33254 with 33512 as based on the CPT guidelines. So we are left with C and D. So as soon as you see, you need to remember that we can't add any modifier to add-on codes. If you check 33257, which is a add-on code, I think so. Yeah, 257 is add-on code. So directly we can eliminate D. So our answer is C here, 33512, 33257, 33508. So you need to remember that for add-on codes, we can't append modifiers. So that's why our answer is C here. Yeah, thank you, Rajiv. Yeah, answer is C here. Okay, guys. So it is very simple. B is wrong. Why means there is no cardiopulmonary bypass code included in the B, and A is wrong. Why? 33254 we can't code 33254 along with any type of cardiovascular or cardiopulmonary bypass procedures based on guidelines. D is wrong. Why? Here we can't append 51 modifier to add-on code. So D is wrong. Here we are left with only C. This is the 33512, 33257 and 33508. Yeah, Rajiv is correct and Sarika is correct. So C is the correct answer. So Anita and Nagatarun try to understand this. We can't append 51 modifier to add-on codes. So okay guys, so try to answer this one. Yeah, go ahead. Now it is 9:59. We can discuss the anyway it is small only. We can discuss the answer at 10 to or any three answers. So here just you need to try on only ICD 10 cm, sorry, CPT codes. You no need to worry about the ICD 10 cm. But if you want to eliminate the codes, if you are familiar with ICD 10 cm, you can try along with ICD 10 cm also. It's not a problem. So add-on codes we can't append modifier. That is the thing here. So we have multiple procedure, that is correct. But the thing is that for add-on codes we can't append 51 modifier. So if you check 33257, it's a add-on code. So if you want good idea, just last week we have published CPT appendices. So you can check that video. You are going to know everything. So what are the codes? We can't append 51 modifier. So it is already published on YouTube, FastCoder 21. So you can go and check that YouTube, video. Thank you, Nagatarun, Sarika, and Bobia. Here we got 2, 3 answers. So we can go ahead and start. So guys, as I told you before, you need to master in modifiers. So which will make your life easy. So here using the modifiers only we can code this scenario. So patient had a dual chamber pacemaker put in 2 days ago. So that is